Hey guys, hey, it's a rhythm therapist. Want to make a video on drug-induced psychosis. So on this case, we have a young person who we know took a lot of drugs at all at the same time, and at this point, we couldn't ask them, what was it you took. You can't have a conversation, a rational conversation with this person. But per his mother, we're thinking a lot of hallucinogens, LSD. LSD, acid, marijuana, different things all at the same time. So, mom started to notice after, about 8 days after this, a lot of bizarre behaviors, a lot of responding to hallucinations, a lot of bizarre, acting out, really significant paranoia, which kind of comes and goes. Absolutely just terrified of authority figures. And so that basically led him coming to our hospital on the adolescent unit. Just the bizarre behaviors intensified, just completely acting out, trying to escape, trying to do whatever he could to bust out, fighting staff, fighting with other peers, running and slamming into doors, trying to get out, not having that ability to have a rational sense. And obviously that is a characteristic of psychosis. And the behaviors kind of come and go. Sometimes it would turn into sexually acting out, trying to make sexual advances on staff. Very extremely paranoid about medication. We're trying to treat this. One of the ways we try to do that is through antipsychotic medications. And paranoia about finite details. Okay, there's sometimes there's little letters printed on some of the medications, and he was paranoid about poison being put in the ink that was printed on those little letters, and so we had to find medications that didn't have so things like that. There was a decrease in some of the acting out and aggressive assaultive type behaviors, and the reality is sometimes these things don't clear up. I've seen kids who come in with the same thing, though not as severe as this, and they've gotten better, they've gotten more clear. Sometimes they still have some of these far out kind of delusional beliefs, and even at their best, it's still there, it's still present, but they can at least have a rational conversation about it. They're not really defensive when they talk about it, and they're in a place where they can go to further outpatient treatment, where they are willing to continue taking their meds, willing to be kind of monitored while they take their meds. But this is not where this kid was at. And it's a really sad thing, because there's no history of to our knowledge, there's no history of psychosis or schizophrenia, anything like that in the family. And so you have a younger person who had a recent uptick in substance use over the last year and a half or so, and it kind of culminated with this, whether it was just experimentation. I don't think it was a suicide attempt by any means. It really just seems like he continued to play and mess with and just experiment with different drugs, different substances, and I think it got a little out of control for him. And the scary thing is, at this point, I can't have a rational conversation with this person. There's no way to, I started trying to meet with him and talk to him. He started telling me that the people needed to get out of the room and that they were listening to him, and he couldn't stop until the people were out of the room and there's nobody in the room. Another time I tried to meet with him, he started taking his paper cups that he had and tearing them up and then rolling them up and telling me that the ink was poisoned on them. So, here's a person who has really lost a lot of touch with reality, and it's outside of their control right now. I think that's the scariest thing, and I'd warn young people, or anybody, when you're messing with some of these substances, I'm not here to tell you right or wrong or do this or that. Honestly, I don't care. It's your life. Do what you want. Therapists will always be there, counselors, doctors will be there to help you, but if you're pushing this boundary, sometimes that boundary bites back, and what you walk away with, whether you care or not, whether you don't care about yourself and you don't care about your life and you don't care about consequences, I don't know how else to put this, but sometimes that boundary really doesn't give a shit. I know that's very blatant, but if I could just warn one person, don't keep pressing with this stuff. Back off at least. Sometimes, I get that people and addicts and substance use addicts don't have control. They don't have complete control. Sometimes it's a chemical dependency. Sometimes that control is taken away, but if you're messing with hallucinogens, if you're messing with these substances and you're playing around, especially if you have a history of schizophrenia in your family, this this type of thing, it's not always going to happen. I think it's pretty rare, but when it does happen and somebody loses control and they lose touch with reality, and they're delusional and they're paranoid and they're psychotic, it's a very scary thing. And so I've only highlighted, a few examples, a few instances of what it's looked like so far. It's a really sad case, and it's really sad. It almost feels like, a mother has had a death in the family, just because the kid that they knew is no longer the same. And anyhow, guys, that's all I got. If you have questions, I'll do what I can to answer them. Obviously within the limits of confidentiality, there's no identifiers, names, people, places, things that I can kind of release to you. But again, yeah, it's really serious stuff. It's really sad stuff. It's a really sad case. If you have questions, put it in the comments below and I'll get back to you. Thank you.